Dr. Noubarani's treatment plan for preventing vascular complications of diabetes mellitus. For centuries, diabetes mellitus and its vascular complications have been a nightmare for people. About 350 million people worldwide have diabetes. Eyes of half of patients with diabetes enter the dangerous phase of non-proliferative diabetic retinopathy, and half of this group enter the very dangerous proliferative phase. Diabetes can be more dangerous than cancer because cancer can metastasize to multiple sites, but diabetes affects anywhere blood vessels are present. Till now, the standard treatment plan for vascular complications of diabetes has cost the world hundreds of billions of dollars with little success.
After this introduction, we can talk about our plan for preventing vascular complications of diabetes, which its absence has been deeply felt. This message is to all patients with diabetes and their caregivers and close relatives. For preventing cardiovascular complications of diabetes, retina is the best indicator for monitoring the complications because that is the only place where we can monitor blood vessels directly and non-invasively. Prevention starts with a precise retina examination that needs to be repeated every 6 months. A healthy retina is a great indicator that you are ready to take the next important steps. For prevention, fasting blood sugar should not exceed 180 mg per dl. LDL should be maintained below 100 mg per dl. Triglyceride should be maintained below 200 mg per dl. HDL should be maintained over 50 mg per dl, and blood pressure should be maintained in the normal range. Non-HDL cholesterol should be maintained below 130. For example, if triglyceride is 150 and LDL is 100, non-HDL cholesterol will be 130. Hemoglobin A1C should be maintained in 6.5% to 8% range. The magical medications for preventing cardiovascular complications of diabetes include a blood thinner, aspirin, 80 mg pill, and a special antioxidant, vitamin E 100 mg or 200 mg if 100 mg was not available. However, vitamin E 400 mg, for reasons that are not clear to me, is not suitable for this prevention plan. To reiterate, the magical prevention plan consists of taking one aspirin 80 mg pill and a vitamin E 100 mg pill once a day with one of the main meals, in addition to monitoring your blood as I described earlier in this video. By following this prevention plan, you can avoid cardiovascular complications of diabetes and easily save your organs such as eyes, brain, heart, kidneys, hands, feet, etc. If for any reason you were not able to follow this treatment plan, you can visit my website and describe your specific situation to get answers to your questions. Note that before any medical procedure, you have to inform your doctor that you are taking aspirin and vitamin E. Also, note that this prevention plan has little effect on the neuropathic complications of diabetes. If I were able to find a way to prevent neuropathic complications of diabetes, I promise to share it with you directly. So in summary, the treatment plan for Preventing cardiovascular complications of diabetes consists of 3 steps. First, an experienced ophthalmologist should confirm that your retina is healthy. I should add that to ensure success of this prevention plan, you need to have your retina examined every 6 months. Second, every 6 months you need to have a blood test to ensure the followings. And third, continued regular use of aspirin 80 mg and vitamin E 100 mg, each of them once a day with a main meal. I should emphasize that if for any reason you weren't able to follow this prevention plan, you can visit my website and describe your situation to get answers to your questions. By following this prevention plan, I'm certain that we can save hundreds of billions of dollars. Millions of patients with diabetes can be saved from blindness, stroke, losing limbs, and tens of other complications. I ask you, if you are not affected by cardiovascular complications of diabetes yet, make sure to follow this prevention plan and recommend it to others. I know that the world is full of erroneous claims and lies, but this prevention plan, which is resulted from over 30 years of experience and research, is honest and effective.
It has been years that almost none of my diabetic patients who followed my prevention protocol in time have experienced any vascular complications of diabetes.